while since I've done a video. My hair has grown extremely long in that time period. No, I'm just joking. The last video that I did was on deductibles, and so that must have been the end of 2017. And so now I am on my soapbox. Well, I continually have been on this soapbox about vitamins. And I felt like I needed to do a little bit of a video because there are a lot of misconceptions about vitamins, particularly prenatals, for our obstetric patients. And it just so happened that I needed to purchase some vitamins for myself. And I went into the section and I understand why there's so much confusion about over-the-counter vitamins and supplements. My focus in this quick video really is on prenatals because that's where I really get concerned. A lot of private insurances do not cover for prescription prenatals, or your copays are very expensive. And so pharmaceutical companies are aware of that, and they've made available some over-the-counter options, some of which can be comparable to prescription prenatal vitamins. So when you go into this vitamin section and you're encountered for prenatals, or you're looking for prenatal vitamins, here's some of the things you'll find. So there's Smarty Pants Prenatal Dietary Supplement. This is a gummy. So gummy prenatals, let me tell you, with gummy prenatals, they do not contain iron or calcium. Now, our government, through the FDA, has made available these handy maps on the back of supplements that tell you really what's in them. And when you look at that listing, what are the things that you don't notice? Probably hard to see, but there's no iron and there's no calcium. Yet this is being marketed as a prenatal, okay? So I'm not here to bash any given brand. I'm really here to educate. So it's not that you can't use this, but if you choose to use this, then you better make sure you're taking an iron supplement and getting adequate amounts of calcium either through your diet or by purchasing a calcium supplement. So you can get calcium as a gummy or a chewable. This is a pure calcium supplement. Now, this calcium supplement isn't sufficient to replace a whole prenatal vitamin, but can be used in conjunction with your gummies and an iron supplement to get everything that you need. The reality is during pregnancy, because you're developing fetal bone, your blood flow is increasing and your amount of blood is increasing. If you don't supplement with iron and calcium, you will be anemic. Okay, and so those are two really important things to look for. The prenatal vitamin that's over the counter that I often will refer patients to is the Women's One-A-Day Prenatal. I tell you that it's in the purple box with the pink writing, and I thought this was great. It has your DHA, it has iron and calcium, until I went to the pharmacy and discovered they came out with a gummy. So what does that mean? Well, that means that this gummy vitamin, when you turn it around, has no iron or calcium, yet is being marketed as a prenatal. Not sufficient. That is a no. If you're going to do the Women's One-A-Day Prenatal Vitamin, use the one that is the solid tablet. Now, I realize that a lot of my patients, particularly some of my younger patients, don't like swallowing pills. And that's why you choose the prenatal gummies. I get it. If you don't like swallowing pills, then I'm going to take you all the way back to the Flintstone Complete with Iron. Solid tablet. These are the ones that tasted like sweet tarts. These are also okay to sub in for your prenatal. You need to do 2 of those a day, okay? When you turn this around, you will see, yes, we have iron, and yes, we have some calcium. Not a lot, but some. Okay, now here's the other confusing thing. Flintstones makes a gummy. What do we know about gummies? I was waiting to hear the response. No iron or calcium, okay? So these pharmaceutical companies are really making it kind of difficult for you to figure out what you need to be doing. And so I just want to line a couple examples up. If you don't like to swallow pills and that's why you've made the choice for a gummy, then I really would prefer for you to go to the old school Flintstone Complete chewables. okay? These are not gummies, they're solids. They taste good, they're like sweet tarts. Do not get the Flintstone gummy. Has no iron or calcium. If you want to do the women's 1-a-day prenatal, which has the DHA or fish oils, which has been shown to be a benefit and is not in your Flintstone, then use the solid women's 1-a-day, okay? Do not get the gummy. Not sufficient, okay? And the Smarty Pants is still a prenatal gummy. No iron or calcium in this supplement. If you just need a calcium supplement, say for example, our postmenopausal patients, then there are a lot of nice chewable calcium supplements. But for those patients in that age category that are postmenopausal, you want to get 1,200 milligrams of calcium and a minimum of 800 of vitamin D. Okay? This is a pure calcium gummy versus your Citrical, which has your calcium and your D3. And this particular one has the full daily regimen for 1,200 milligrams of calcium. Okay? So this can be sufficient for a postmenopausal woman who needs to supplement for calcium and vitamin D for bone loss. This is a great total option. And I'm sorry it's not a gummy. Okay? For our prenatal patients, again, the women's 1-a-day, that is the solid tablet, or your old school Flintstone vitamin, 2 of those a day, the one that's not a gummy. I hope this has clarified some issues for you. I've had patients who have been using gummy vitamins and then they come to the end of the pregnancy and say you have an unexpected significant blood loss. Well, if you walk into that experience anemic or having a low blood count, then there's an increased risk that you may need things like a blood transfusion. So your best way to prevent yourself from being in that situation is to use a very well-rounded prenatal vitamin that is solid, okay? And also to make sure you're eating a well-rounded diet. The final thing that I will say that is very important to me to impart is that to have a healthy pregnancy, you have to walk into that pregnancy healthy. And so preventative care, visits with your family doctor, making sure that any chronic illnesses are being managed appropriately and optimized is the best way to assure a pregnancy that is smooth and not rocky. I hope this helps and have a great day.